spirituality, depression, and suicide. And we're talking to Dr. CPoe. Of course, Dr. Poe, during this last segment, let's give you an opportunity to talk about suicide and what we might be able to do in a real sense to prevent the prevalence of suicide. Certainly, we might not be able to stop it completely, but I think that you've indicated earlier that the statistics are going up on it, and so if we can do anything, that we might be able to intervene here.
Right. The prevalence rate of suicide in the U.S. is approximately 30,000 per year. That's true for about the last 10 to 15 years in comparison to homicide, which is significantly lower. In 1997, there were 21,000 homicides, 30,000 suicides.
So more people are actually killing themselves than people are killing one another.
That's correct. And it's also estimated that some of the homicides, some of the people who kill other people are really suicidal, because when a person is in despair, they're also in a condition of rage, and rage may go outward and or inward, all right? So some of the people who kill, it's estimated that they are suicidal. It's also true that some of the people who get killed, who are the victims of a homicide, it's also felt that in some cases these people set themselves up to be killed. They were suicidal. They chose not to take their lives directly, but they provoked somebody else into taking their life. Also, it is true that the suicide statistics are not accurate because suicides are often concealed. They are concealed because insurance companies don't pay for suicides, plus the fact that families don't want to deal with the shame and the embarrassment and the stigma of a family member committing suicide. So suicide is very prevalent. And it is also true that the suicide rate among our youth has gone up considerably. In the last 30 years, it's increased by 300%. Persons between the ages of 15 and 24. Also, the suicide rate among Afro-American teenagers is going up, especially between the ages of 15 and 19. So suicide is a real problem. It often occurs in clusters. You recall in Omaha, Nebraska in 1986, there were 7 suicide attempts. 3 of those youth, high school students, killed themselves. In Hickman County, I think it was 2 years ago, there were 13 suicides. In Blount County, where Maryville, Tennessee, near Knoxville, I think it was 2 years ago, a year ago, there were 35 suicides. I think these were among our high school students. Now, what they did, though, in these 2 counties, they developed a suicide task force. They decided to inform people to be aware of the warning signs. And by the way, let me say a word about that. One of the warning signs is a change in personality or behavior. The person may begin to give away prized possessions. The person may withdraw, okay, social withdrawal. The person may begin to talk about death. The person may, if an adult, they may begin to make a will. The person often has a history of having committed suicide before. The person may increase their intake of alcohol and drugs. The person may have experienced a recent loss of a parent, loss of a loved one, or a loss of a job. The person may have gotten some distressing health news, such as they may have discovered that they have a heart disease or cancer. These are some of the warning signs. So now what can a person do? Well, if a person shares with you that they're thinking of suicide, listen, okay? Show concern. Let the person talk it out. Just talking about suicide doesn't cause people to commit suicide. And then try to get some professional help for that person. Be alert to the warning signs. And when you see them, you need to go in and see if you can get the person to open up and to share what's going on in their mind. Here in Nashville, there's a crisis center, 244-7444. They can be called, and there are counselors there. They will offer 10 to 30 minutes of counseling. They can call 911 if they feel overwhelmed by the urge to take their lives. And they will send someone out, an ambulance out to take the person to the hospital. Go to an emergency room of any hospital in Nashville. They're required to see you. They have some person in the mental health field on the staff there that can be called or will be called that will come and talk to you and help you to kind of sort things out. So help is available. There is what's called the Tennessee Suicide Prevention Network. It's divided into, I think, about 8 districts. It has divided the state into 8 districts, and its role and goal is to educate people as to the warning signs that people often give. Most people, before they kill themselves, give a warning sign that they are thinking about it or that they're about to do it. Also, one of the statistics I want to share, and that is 3 times more men kill themselves than women, yet we know that women are 3 times more often depressed than men. So the perception now is that depression is the major risk factor leading to suicide. Well, based on that statistic, that women are more often depressed, yet men more often kill themselves, you kind of wonder if that's true. I think despair is much more a significant risk factor for suicide than depression. Now, why is it that men more often kill themselves? I think it's primarily because